Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. Today, it's Lima Dental Associates. And with us, of course, in the studio is Dr. Wesley Shankland. And I know you got something important to talk about.
Good morning, George. How are you today?
I'm doing fine, thanks.
You know, I hate this hot weather. You know, people up here say, well, it's better than cold. Well, this is Ohio, isn't it?
Yeah.
If I wanted this, I'd live in Alabama. However, let's talk about obstructive sleep apnea today.
Okay.
You know, obstructive sleep apnea, you might say, why would somebody go to a dentist?
I was going to say, because that's snoring.
Yeah, that's right. But the reason is because some of us have been trained. That's one of the reasons Dr. Rizzavato brought me to Lima Dental Associates. You know, I treat TMJ issues, headaches, facial pain, and sleep apnea. Sleep apnea, I'm going to jump ahead here, is treated with CPAP or oral appliances. That's why I'm here. Now, a lot of people, they say as many as 70 million may have sleep apnea, and I honestly think more than that.
Really?
Yeah, sleep apnea, if you don't get enough oxygen exchanged in your body when you sleep, it can affect your heart, your nervous system, specifically your brain, effects on your liver, kidneys. It can have effect with type 2 diabetes, all kinds of depression, weight loss or weight gain, loss of libido, all kinds of issues it can have effect with. So obstructive sleep apnea is important. So a patient may be sent to me, because a sleep doctor knows I do this, or somebody sends a patient to me, another kind of doctor. I examine the patient to determine anatomically and from their history, do they have sleep apnea? If they do, I send them to one of the sleep doctors here in Lima. And I have to say one thing, we have outstanding sleep doctors in Lima. I mean that, really. Because I work with them in Lima, I work with them all around Lima and in Columbus and those areas. The doctors here are nice, and both hospitals are wonderful. They'll examine the patient. What they'll do is some kind of a test called a polysomnogram, either in the laboratory there or at home, and determine if they have apnea. They'll make a diagnosis.
And I notice they give your website address here.
Yeah, or Lima Oral Sleep Center.com is a great place. We have a questionnaire on the screen, I believe, at some time in this interview, that you can see if you might have sleep apnea. Go to there. If you do, the doctor may send you back, or you may come back to see me for an oral appliance instead of CPAP. So we can treat these people and prolong their lives, George. I mean it, prolong their lives with oral appliances and decrease their apnea.
But it isn't necessarily just because you snore.
No, not everybody who snores have apnea, but they should be checked.
Okay, thank you.
Thank you.
That's our report for today.